In our project, we are aiming to switch our in-center hemodialysis patients to home hemodialysis program, which performed at patient's home, offering a flexible schedule and potentially leading to better health outcome. As a result of our initiative, we were able to improve our patients' health outcome by reducing the rate of hospitalization, ER visits, and all-cause mortality by almost 50%. Value-based care is a new challenge in a healthcare system, aiming to improve patients' outcome while reducing the cost. Home hemodialysis represents a significant shift toward value-based care in a kidney disease management, improving the quality of care and outcome of a chronic serious problem while reducing the cost.